Hello, everybody. For those of you who do not know me, I am Saeed Abdallah. I am a chest physician with experience spanning 30 years in the Royal Brompton Hospital in London. With the new wave of COVID 19 coming, hopefully not, I thought I'll talk to you about what to do if you have symptoms. Not every fever is COVID. Not every cough is COVID. Not every sore throat is COVID. Not every upper respiratory infection is COVID. Not every lower respiratory infection is COVID. Infection should be treated with antibiotics and, if need be, prednisolone. These are steroids. Important to remember that not every breathlessness is COVID. Sadly, I hear from colleagues that people who had symptoms and were proven to have COVID were told to go home and isolate and were not given any treatment. This is, I am sorry to say, criminal. If somebody has COVID, one should treat with antibiotics, with prednisolone, steroids, with antithrombotics, and if need be, anti-asthma medication if they are short of breath. Not to treat is simply criminal. People who do not have COVID and have respiratory infections, upper or lower, should be given adequate antibiotic treatment. Sadly, there is this culture of antibiotics are bad for you. Over 30 years of working at Brompton, I have never seen somebody dying because he or she was given antibiotics. The opposite is true. People die of what we call sepsis because they were denied antibiotics. So any infection should be treated promptly with antibiotics, if need be, with cortisone or steroids if they are short of breath. People who have asthma, now the autumn is here and winter is coming, I would like to remind everybody with asthma to take the preventers regularly. Remember these words. Take the preventer when you are well to stay well. Very, very important. Sadly, there is a cost-driven advice telling people if they do not need the preventer, not to take it or scale down the preventer. This is wrong. Preventer medications are expensive, but are most important to control asthma. Nobody with asthma should feel short of breath. People should take the preventer inhaler when they are well to stay well. Very important. Sadly, this culture of denying people expensive prevention treatment is prevalent. Asthma nurses tell patients if they are all right, there's no need to take the steroid inhalers. They are steroids and they scare them. People die of asthma. Sadly, in the United Kingdom, as we speak, every year 1,500 people die of asthma. This is scandalous. In Finland, nobody dies of asthma. because people take the preventer when they are well to stay well. The advice is wrong. Like, don't take antibiotics unless you have a severe infection. That is criminal. That is criminal. Or the fear of antibiotic resistance. That is criminal. Nobody dies of antibiotic resistance, but people die of sepsis caused by the lack of antibiotics. And we have seen children dying. Assuming the child is running a temperature, nothing wrong, give him paracetamol or her paracetamol, child dies of pneumonia. This should never happen. So hopefully stay safe and observe social distance and wear your face mask and treat symptoms. Don't just self-isolate and assume that you have COVID. Cough is infection. Shortness of breath is asthma or infection. High temperature is infection. These should be treated. If someone has COVID, there is nothing called go home and isolate. No, a course of antibiotics, maybe 2 antibiotics. Azithromycin is very good, 500 milligram a day for 6 days. Better still combine with another antibiotic, like coamoxiclav, 500 milligram 3 times a day for a week. If they are short of breath, a short course of prednisolone, 30 milligrams a day for 2 weeks. Cough mixtures, if necessary, codeine tablets to stop cough, and if breathless, steroid inhalers and relief inhalers, that is salbutamol. Stay safe. Thank you for listening.